So if a patient goes to you and they're just wearing a denture, what are their options when it comes to dental implants?
And if the patient's just wearing a denture, they already know the limitations. They know about the denture glue. The taste of it can be nauseating to some patients. They know about the slipping and the fear that they're going to pop loose at any given time. Another thing that people don't think about, that may be thinking about going into dentures, is it's not just replacing the teeth. Yeah, we can take out their old broken down teeth and make them look good with dentures, but there's also a big part of gum replacement on there, and on the upper that covers the palate, so it affects the way individuals can taste and eat food. It's a big drawback. The lower dentures surrounded by moving parts. You got the tongue in the middle, you have the lips and the muscles in the lips and cheeks surrounding it. So they've coined the lower denture the floating denture. So even glue sometimes doesn't do a great job at holding those down. There's things we can do for maybe patients that want to get rid of the adhesive, that are okay with the other things we mentioned. Dental implants, a snap denture. We place the dental implants under local anesthetic, or we can use the conscious IV sedation for that procedure as well. It's a simple procedure.
And they just snap in.
Takes less than an hour.
Out.
They snap in, they snap out. One benefit is it's easy to clean these. There are limitations to what they can chew. Really sticky things could dislodge the denture if they try to bite into a candy bar or
maintenance. What about maintenance?
Maintenance on this is quite easy, because they're going to snap the denture out and they're going to take a toothbrush and brush the snaps that are based on the implants in their mouth.
You say it wears out. They may have out-of-pocket expense.
There's going to be maintenance. The dentures are still dentures. Dentures are a polymer, so they're a form of plastic. They can break. They can be repaired easily, but that just means another visit. The snaps are designed to wear so that the implants don't. So the snap maintenance is another thing. Maybe every 6 months they'll be coming in to have the snaps replaced. But it is a big improvement over just straight dentures alone. There's no doubt about it.
What's the next level up?
The next level up, now we're talking about teeth that don't come in and out. These are the dental implants that feel the most like natural teeth. They don't have the borders on them. They don't have the part that goes across the palate that patients can't stand. And they are not moving at all. Where the snap dentures might have a little bit of movement, like I said, if they're trying to bite into something like an apple or candy bar, it may dislodge. That's never going to happen with these teeth. As far as maintenance goes, they're going to brush these teeth like they're their own. So a toothbrush, toothpaste, mouth rinse. I even tell patients they can use a water pick to clean underneath it. And on an annual basis, I'm going to see these patients just to see how they're doing.
Like a teeth cleaning.
Like a teeth cleaning.
So upper and lower teeth, they don't come out. They can eat steak, or certain things they have to be careful with. Could they eat nuts?
So the final product is a huge difference with these teeth that don't come in and out versus a snap denture. A snap denture is still a denture. It's still that plasticky polymer material. The teeth that don't come in and out, they end up with what we call zirconia, which is hard as diamonds. You've heard cubic zirconia before. Artificial diamonds. But they look like tooth enamel. They look beautiful, and they are as hard as diamonds.
So upper and lower teeth.
There's
and
nothing
you say
they
people in
can't
their 80s are doing this. Like almost 90 years old are doing this.
All the time.
So age is not an issue.
Age is not an issue. People want to enjoy life. People want to be able to eat. Eating is a social thing.
What if you're on like 3 or 4 medications, like maybe even osteoporosis, and you're in your 80s? Can you do it or not do it?
Well, medical history is a big thing that we need to review with the patient, and we always do that on that initial visit. But some of the more common things like blood thinners, you mentioned osteoporosis, diabetic medications, these are not generally reasons that these procedures can't be done. We do have to look at it. Sometimes we have to do a consultation with their doctor, but most of the time, I say 99% of the time, we can work around that. We can get these procedures done for these patients.
So you can be on like blood thinners, things like that, and get this procedure upper and lower teeth?
Yes, absolutely.
Okay.